Okay, getting back into doctor mode, full-fledged doctor in the clinic mode. I've got scrubs on, I've got glasses, so it's getting serious. So let's just jump into it. Ear keloids. Don't let these things get too big. They can start out very small, like a little pinpoint or area of firmness that you get in your earlobe or the cartilage when you get your piercings done. In the early stages of having issues with that, for instance, have anything that you think might have been an infection, an irritation, some sort of physical trauma, or you switched an earring that was made out of a pure metal such as gold, titanium, steel to something kind of cheap that may have nickel and aluminum alloys in it, that does appear to be an irritant for the skin and the tissues that these earrings are in. If you start to develop a raised, firm area of tissue around the base of your earrings, don't ignore it. Because once these things go from being small and pinpoint and something palpable and you can barely see it to something that's pea-sized, it's still pretty manageable, but these things can get out of control very quickly. And so let's go over a few examples of cases that were caught early and are working out really well, and some that just went way too long. You just don't want to be the person that waits way too long. So here we have a case where it was two very small keloids on the posterior edge of his helical rim. I was able to take this out simply by removing the skin, the subcutaneous tissue, and a small portion of the involved cartilage. The anterior side of the ear was just fine, so there's just an incision on the back, no recurrence, everything went great. Caught early. Nice work, early intervention for the win. Woo! Alright, next case. So here's a situation that's a little more involved. The keloid from a stud was through and through the ear, but the scar tissue didn't come to the outer edge of the cartilage nor the skin, so I was able to do it with an incision on the front and the back. This is about 3 weeks after the sutures were removed, so it's healing very nice. This one also caught a little more on the early side, no recurrence, doing great. Now this one obviously went a little longer, got a lot larger, but she's very lucky. It was really mostly on the posterior edge and on the inside of the ear, so we're able to take it through and through, or full thickness as we say, and successfully got out all the scar tissue with no recurrence. Now this one's a little trickier. It looks like it's smaller than the other one, and technically that's true. However, the scar tissue did extend and infiltrate the cartilage all the way to the edge of the helical rim and to the skin underneath. So I needed to remove it essentially like a slice of a pie. So when closing the defect, we had to do every layer, the cartilage layer, the subcutaneous layer, and the skin. And even though I had to cut through the edge of the helical rim, it ended up looking quite nice after about a month, and it healed great with no recurrence. Now this lovely person unfortunately saw a couple of dermatologists who would inject this with steroids, which by the way doesn't do anything for situations like this, even when they're small. But she was very fortunate, we were very fortunate that we were able to get it out without having to remove a significant amount of cartilage, and we were able to keep the overall look of the ear. So please do not wait to come in and have these things evaluated. If you're starting to notice one after a piercing, it just gets harder and harder to manage and much more likely to have a recurrence the longer you wait.